This presentation is 31 functions of the nose, and the idea was taken from Dr. Morris Cottle, who was an ear, nose and throat doctor back in the 1970s. He said the human nose has 30 functions, but I couldn't locate his list anywhere on the internet. So, I decided then to put a list of functions of the nose together myself, and it's currently at 31, but it will expand over the years, no doubt, as more functions of the nose, or at least more discoveries of what the nose does, is added to the science. Looking at the learning objectives here, it's to understand the role of the nose in cognitive function. So, for example, when you breathe through your nose, how it enhances visuospatial awareness, influences behavioral responses, and also improving cognitive function. To recognize how breathing through the nose helps with respiratory health, including oxygen transfer from the lungs to the blood, improving oxygenation during sleep, helping to prevent exercise-induced bronchoconstriction, and also exploring the nose's contribution to overall health. So, for example, the production of nitric oxide, improving lung blood flow, supporting immune defense, and the role of the nose in reducing respiratory infections. The first function that we look at is by breathing in and out of the nose, it helps to induce relaxation. So when you're breathing in through the nose, there is a resistance imposed by your breathing. And that's going to help slow down the speed of the air coming into the body. But also as you breathe out through the nose, that same resistance is slowing down the speed of the air as it leaves the body. So whenever we have a relaxed and a slow and a gentle exhalation, the body is telling the brain that the body is safe. Your nose does impose a resistance to your breathing. That's about 2 to 3 times that of the mouth during wakefulness. Now the opposite happens during sleep, that your mouth imposes more of a resistance to your breathing versus the nose during sleep. So a resistance to your breathing is a good thing during wakefulness, so during the day, because it's helping to slow down your breathing. And also the quality of the breath as it comes into the body is much different with nasal breathing versus mouth breathing. You typically do breathe slower, but you also breathe lower. So all of this is helping to promote relaxation. And I suppose when it comes to breathing exercises, we always say to our client, whenever you want to tell your brain that your body is safe, take a soft breath in through your nose and allow a really relaxed and a slow and a gentle breath out, because it's the speed of the exhalation that's going to influence your relaxation response. Number 2 is by breathing in and out through the nose, it helps to improve cognitive function. Persons with normal function of the nose have improved cognitive function and energy levels in comparison to persons with chronic nasal issues. I find this very interesting because of all of the functions of being human, cognitive function, it must be one of the most higher functions that we can have. It includes ability to make decisions, concentration, reasoning, questioning. So in this study here of 100 persons to investigate cognitive function, persons with nasal congestion, stuffy nose, were found to have significantly more cognitive dysfunction and fatigue on validated instruments and had worse reaction times on computerized testing. So coming back to that, in terms of cognitive function, now, could that be related primarily to poor sleep quality as a result of having a stuffy nose? As far as I can remember, researchers haven't identified it solely to just having poor sleep, that there seems to be some other issue going on, that a stuffy nose can indicate inflammation, and when there's an inflammatory response, cognitive function and sleep can be impacted. Smell and partner choice. I often feel this is quite an interesting one, that we select our mates based on a sense of smell, and throughout evolution, it wouldn't have been good if genetically similar people were getting together. So two people with very similar genetic makeup could be related, and inbreeding increases the risk of unfavorable genes passed down from one generation to another. So scientists discovered that signals are picked up via smell, referred to as olfaction. The influence of body odor in mate selection was confirmed in experiments back in 1975, and findings show that women prefer the odor of men who are genetically dissimilar to themselves. So it's quite interesting that it's the communication of the nose to the brain that helps us select our partner choice. Number 4, visuospatial awareness. So visuospatial awareness would refer to our ability to have our attention on something that's, say, far out in the distance, but at the same time we're able to scan our environment of potential threats. So you can imagine how important that would have been thousands of years ago, that predators were out there. So it was very important that human beings had a means of assessing their surroundings to make life or death decisions. Now, visuospatial awareness, it has a role today because, for example, if you're driving your car and you might have your attention on the lane that you're in, but you're also observing what's happening on the lane either side of you. Or if you're playing sports, you might have your attention on the ball, but you're also reading the game and you're reading the field. So this team here theorized that this ancient sensory system might benefit from nasal inhalation, and that in modern life and competitive sports, nasal inhalation might automatically trigger conditions in the brain that optimize visuospatial focus. They demonstrated that nasal breathing synchronized electrical activity in the brain on a wavelength that helped to maximize visuospatial focus. Number 5, this is mediating the sense of smell in terms of inducing behavioral responses. So this sense of smell is a primary function of the nose, and it plays a significant role in aiding behavioral responses by activating the amygdala and the hippocampus. So the amygdala is responsible for the emotional processing of odorant molecules, with odors being able to serve as rewards or punishments in the associative learning process. I think we've all experienced this. We get a sense of smell, and the next thing is it's bringing us back to maybe sometime in our childhood, and so there's an associated learning with that sense of smell. Number 6, reduced vocal effort. I think it's really important for singers to be able to breathe in and out through the nose, bearing in mind that the vocal cords are in the upper airways, but how do you protect them? And how many singers are not only, of course, during singing, the mouth is open, but also during sleep, during physical exercise, during the day. So it may not be the easiest to breathe in and out through the nose during singing or during talking for that matter. If I was to spend every sentence nasal breathing in between each, it would really slow down the cadence and the rhythm of my presentation here. So for example, if I'm talking for a little bit, and then if I pause, I have to breathe in through my nose. And then I talk again. And you can see how that would help. Well, it would certainly disrupt the flow of what I was saying, because again, as soon as I need to draw in a breath, I have to pause for a brief period of time. And then I talk again. Now, some people can do it naturally, and some people might argue that you have a better deliverance when it's slowing down your speech and it's giving people, your audience, enough time to gather what you are talking about. So those gaps could be quite helpful. But I just feel in terms of delivery, the breath can be in and out through the mouth, especially if you're talking for a period of time, but you should not hear your breathing. In any event, it's not just about how do you breathe during singing. People will often ask, well, how should I breathe when I'm singing? How often do you sing a week? How much time do you spend singing? It's probably not all that much time. So more importantly is, how do you breathe when you're asleep? How do you breathe when you do physical exercise? So if you want to protect your upper airways, you have to be breathing in and out through the nose. But look at the big picture. Is your mouth open when you're sleeping? Do you wake up with a dry mouth in the morning? If you go for a jog, do you have your mouth open? So think about your nose and the benefits of nasal breathing in terms of warming and humidifying the air. in terms of protecting the upper airways. So compared to mouth breathing, nasal breathing can naturally humidify and filter incoming air. This can help to prevent irritation and inflammation of the vocal cords, leading to improved voice quality and a lower risk of developing voice disorders. Therefore, breathing through the nose can help to reduce the vocal effort required during sleep. It's important for singers to maintain nasal breathing during their everyday life, including exercise, rest, and sleep. Breathing through the nose helps to prevent dryness of the larynx. Number 7, nasal resonance. So the nose plays a crucial role in speech by creating nasal resonance. And this occurs when sound waves from the vocal cords resonate in the nasal cavity, producing a unique quality to the voice. So you know it yourself, if you have a head cold, it's going to sound quite a bit different than if you don't. So in terms of nasal resonance, the tone of voice and how we project what we are saying, the nose does play a crucial role. Without the nose, the voice would sound monotone and lack depth. Additionally, nasal resonance helps to add emphasis and nuance to our speech, allowing us to communicate more effectively with others. Conversely, too much nasal resonance, hyper, decreases speech intelligibility and impairs social interaction. Number 8. So this is the connection between the breath, breathing through the nose, and recruitment of the diaphragm breathing muscle. So the diaphragm breathing muscle, of course, is the main muscle that's responsible for respiration, and it separates the chest from the abdomen. But if we breathe through the mouth, we typically engage more of the upper chest. Not so many studies, unfortunately, on this. In practice, though, you can demonstrate it to your students all the time. Simply ask your students, take the breath through the mouth and see and check like what part of the body moves more. You know, for the vast majority of people, when they open their mouth and they take a breath, especially if it's a fuller breath through the mouth, it typically engages the upper chest. So nose breathing, it does change the quality of the breath, you know, in terms of the air as it's coming into the lungs tends to be drawn into the lower regions of the lungs. And of course, the diaphragm breathing muscle isn't just for respiration, but it's also connected with the emotions, it's connected with the mind, and it also provides stabilization for the spine. And every breath that we take with good recruitment of the diaphragm, that helps with lymphatic drainage, with venous return, so blood flow back to the heart, the lymph system. Lymphatic drainage is very important because the lymph system could be likened to the body's sewage system in terms of getting waste from the body, but it doesn't have its own pump. So it's reliant on the action of the diaphragm. And with every movement of the diaphragm, of course, with every breath, there's movement of the diaphragm, and that's helping to pump lymph throughout the body. So for waste removals. So for persons with upper chest breathing, switching to habitual nasal breathing is important in rehabilitation. And this is relevant to all modalities: physiotherapy, physical therapy, yoga, Pilates, working with the biomechanical dimension of breathing. And yeah, so it comes back to this, you know, if you have an individual, you have a client, say, coming into you, and that client is breathing a lot in the upper chest. Well, if that client is a mouth breather, are they really going to get good recruitment of the diaphragm if they continue to breathe in and out through an open mouth? So to ensure a better outcome long term, it's very important to have the individual breathe in and out through the nose during rest, during exercise, and during sleep. Nose breathing, this was identified back in 1988. I always find this is quite an interesting one, that the partial pressure of oxygen in the blood increases by nearly 10% by breathing in and out through the nose. That alone should point to the importance of nasal breathing. And that was discovered by researcher Swift, published in The Lancet back in 1988. So how might that happen? Well, there's a different context in terms of as air is drawn into the lungs, the air is, that greater parts of the lungs are ventilated than with mouth breathing. But also, of course, as you bring air through the nose, it picks up the gas nitric oxide, and nitric oxide is helping to open up the airways and also to help to dilate the blood vessels in the lungs for a better gas exchange to take place. So nitric oxide also helps to redistribute the blood throughout the lungs. So there may be a number of reasons why the partial pressure of oxygen in the arterial blood increases by nearly 10%. Now, the PO2 in millimeters of mercury, which is the partial pressure of oxygen, whatever the PO2 is in the lungs will determine the PO2 in the blood. And another aspect about nasal breathing is that when you breathe out through your nose, it helps to maintain alveoli, that the small little air sacs in the lungs are more open, so they don't deflate fully. And that may be important because then during inspiration, it's easier for the air to move into the small air sacs for a gas exchange to take place. So yeah, one of the functions of the nose, pretty important one at that. I spoke about nitric oxide. This gas was first identified on the exhale breath of the human being in 1991. It performs so many different functions, and it is produced in the nose. It's also produced in the sinuses surrounding the nasal cavity, and it helps to maintain lung function and may help to protect against respiratory infections. Now, we do have a presentation on nitric oxide where it goes through all of the different roles of nitric oxide. And the author of this paper here, Professor John Lundberg, his title is Professor of Nitric Oxide. By breathing in and out through the nose, it helps to dilate blood vessels in the lungs. And you can imagine the extent of the capillaries throughout the human lungs, that the area of contact between the small little air sacs, the alveoli, of which there are 500 million of them, and the blood capillaries is between 50 to 100 square meters. So by breathing through the nose and harnessing nasal nitric oxide, it helps to dilate these blood vessels and improve arterial oxygenation compared with oral breathing. Number 12, again, nitric oxide plays a role with this, that the transition of human beings to standing upright, this would have negatively impacted gas exchange because of gravity, that there would have been greater concentration of blood flow in the lower lobes. Now, when we breathe through the nose, we pick up nitric oxide, and inhaling that nitric oxide laden air into your lungs helps to redistribute the blood throughout the lungs. So the upper regions of the lungs have increased blood flow, and it could be as much as 24%. And of course, with increased blood flow meeting ventilation, there's a greater opportunity for gas exchange to take place. So the authors of this paper state that nitric oxide from the nose could have emerged in bipedal mammals, not only to improve oxygen transfer from the lungs, but also to protect the body against chest infection. Now, we've always seen it over the years, people coming in with respiratory complaints, and very often they may have been more susceptible to chest infections. But when we got them breathing through their nose, improving their breathing patterns, increasing their control pause, their susceptibility to chest infections greatly reduced. Could that have been down to nitric oxide? Because, of course, nitric oxide is antiviral and antibacterial. So, number 13, when we breathe through the nose, the air passes through the nasal passages lined with mucus, hairs, and immune cells. So, this is a defense, in terms of the body protecting. The nose is helping to defend against inhaled pathogens that are in the air. Now, our mouth doesn't have this mucus, these hairs, these immune cells. So the mouth is, in terms of defense of air coming into the body, simply doesn't do the job that the nose can do. So these mechanisms inside the nose help to trap and remove harmful particles, such as bacteria and viruses, from the air that we breathe, preventing them from entering into the lungs. And we have to bear in mind, the work that we put on the lungs to do, just during rest, we could be breathing 12, 14 breaths per minute. Every breath is a half a litre. And that's happening every minute, every hour, every day. But then if we do physical exercise, we could be breathing as many as 50 breaths per minute. And the volume of each breath coming into the lungs could be 3 litres. So we could be breathing 150 litres of air per minute during physical exercise. Now that's pretty intense physical exercise. But if you're breathing 150 litres of air per minute, what's coming into the body with that breath? So your nose is the organ that helps to filter and make sure that the air that's coming into the body is conditioned before it comes down to the lungs. You don't want to be breathing in harmful particles into your lungs, because that's only going to cause irritation to the airways. It can cause inflammation, could even cause damage to the airways. So whatever chance we have, it's really important to be breathing in and out through the nose in comparison to the mouth. The nasal cavity contains enzymes and other chemical agents that can destroy harmful substances before they enter the respiratory system. Enzymes found in the nasal mucus that can break down the cell walls of bacteria, rendering them harmless. So it's not that long ago that COVID-19 was about, and nobody was talking about breathing in and out through the nose versus through the mouth. The emphasis was on wearing a mask, washing hands. But what about the nose? I remember I was in a train in London in February of 2020. There was an awareness of COVID. It wasn't in lockdown yet at that point. The train was quite busy. And I was only thinking to myself, well, the person next to me could be infected with COVID. I didn't know, but I didn't want that disease coming into my body, or that virus coming into my body. So what I did was, on the train, I kept my mouth closed and I breathed hardly any air. So I minimized my breathing for the entire duration of the journey. I felt an air hunger all the way through, because my take on it was this: if somebody had the virus close to me, I wanted to make sure that I didn't take all that much of a load of the virus into my body. And if I was standing there with my mouth open, well, I'd be taking a much higher load of the virus, and maybe my immune system wouldn't have been able to fight it. But if I had my mouth closed and I'm breathing through my nose will help to neutralize some of the virus if it was around coming into my body, but also the fact that I breathed hardly any air. So I was minimal breathing in and out through the nose, that if there was a virus in the atmosphere, I was going to reduce the viral load, which gave enough, it may have helped in terms of not overloading my immune system. So that was my take. I think it's still logical to this day. If you have a child and the child is in the classroom and there's other kids there with head colds, it would be very important for the child without the head cold to have the mouth closed, to breathe in and out through the nose, because the nose, that's what the nose does. It helps to clean the air before that air comes down into the lungs. So number 14, helping maintain elasticity of the lungs. We spoke about Dr. Morris Cottle at the very start of this presentation, and he's a very well-known rhinologist, and he spoke, at least this is one of the functions of the nose that I could find, that he said that breathing through the nose, it imposes a resistance to both your inspiration and your expiration, and this in turn helps to maintain normal elasticity of the lungs, thus ensuring optimal conditions for gas exchange. So of course, when we talk about gas exchange, that's oxygen passing from the lungs into the blood and carbon dioxide passing from the blood into the lungs. And how might nasal breathing by helping to maintain the elasticity of the lungs? Well, we don't want our lungs rigid. There are conditions whereby there's fibrosing of the lungs or scarring of the lung tissue, and that reduces the elasticity of the lungs. We want the lungs really elastic, so there's not so much effort involved in terms of inflating the lungs, and also during expiration that the air is leaving the body. And that's very, very important. So a better gas exchange takes place when there's normal elasticity of the lungs. Number 15 is warming. The nose plays a vital role in thermoregulation, or the body's ability to maintain its core temperature within a specific range. So quite interesting. Very often we think about the nose as just warming that air so that there's warmer air coming into the lungs to help with the lungs. But it's not just helping with the lungs itself, but it's actually helping in terms of nasal breathing, helps to maintain body temperature to some degree. The nasal passages are filled with blood vessels that help to dissipate heat from the body. So as we inhale, the air is passing through the nose, is warmed by these blood vessels, helping to regulate our body temperature. The nose can also prevent overheating in hot environments by increasing blood flow to the skin. So it's quite an interesting function of the human nose. Now, on a cold day as well, you have to think about it that the body doesn't want to be wasting energy unnecessary. So during inspiration, the nose is warming the incoming air, but during expiration, the nose will recover the heat from the breath. So it's a little bit like heat recovery system that's in some houses, that heat then is not lost so easily from the body. Number 16 is humidification of the incoming air, and this is to humidify the air before it reaches the lungs for gas exchange. Conditioning of inspired air is achieved through the evaporation of water from the internal surface of the nasal airway. So by taking air in through your nose, it picks up moisture, and of course it's heating the air, it warms the air as we've seen in the previous slide. And this is very important because taking warm, moist air into the lungs helps to prevent the lungs from drying out, because if the lungs dry out or if they cool, the lungs can become inflamed. And if there's inflammation of the lungs, it means that airways narrow, breathing becomes more difficult, and this in turn then would manifest to say asthma or wheezing or coughing or bronchospasm in athletes. Humidification occurs within 80% of the air before it reaches the lungs. Air is heated through conduction, convection, radiation, with blood flow in opposite direction to incoming air. In response, allows for greater efficiency for warming the air. So especially on a cold day, you don't want to have your mouth open taking that cool, dry air into your lungs, because it's only going to aggravate your airways. So your nose is warming and moistening the air. Now, of course, in terms of water balance, the nose helps to regulate water balance by conserving water during exhalation. So you can use your phone to identify with that. I often ask my own students is to breathe onto the glass with your nose and just check how much moisture has left the body, and then do the same breath with your mouth. And as you breathe out through the mouth, pretty much the entire screen is going to be covered in moisture. So when you breathe out through your mouth, you lose a lot of moisture. That's why I often wondered about, say, in yoga, there's very often an emphasis to breathe in through the nose and out through the mouth. And say in a country like India, which is very, very hot, if you breathe out through the mouth, it can help to cool the body. But the problem with breathing out through the mouth is that you also lose moisture. So I do understand that, yeah, breathing out through the mouth, it may have originated in India in an effort to try and cool down, especially during physical exercise. You don't want to risk the body of overheating during high intense exercise by continuously breathing in and out through the nose, that it may be necessary to breathe partly or through the mouth, because that can help with thermoregulation. But yeah, coming back to this, when you breathe out through your nose will help to capture and hold on to that moisture so that it reduces water loss from the body. And it's quite significant, the extent of the water loss. It's a 42% greater water loss when you breathe out through your mouth versus through your nose. So you're much better off breathing out through your nose than breathing out through your mouth. Whenever you look at studies investigating individuals with sleep apnea, if they're breathing through their nose or breathing through their mouth, they typically always fare off worse if they have their mouth open during sleep. I always find that's quite interesting. So this paper here, that's a 2021 paper published in Laryngoscope, that mouth breathers had worse sleep apnea. They had also lower oxygen desaturation during sleep. So in terms of sleep quality, it's much better if you breathe in and out through your nose versus your mouth. The nose is necessary for proper nasal breathing, and this has been shown to contribute to deeper and more restful sleep. Many people who monitor their sleep using, say, Whoop or Oura Ring, they often find that when they switch to nose breathing during wakefulness and also during sleep, that their sleep quality improves. And this is because breathing through the nose can help to reduce the severity of snoring and obstructive sleep apnea. It is important to wake up with a moist mouth in the morning, which is an important indicator of nasal breathing during sleep. Now, in saying that, you don't want to just apply any sort of tape across somebody's mouth if they have obstructive sleep apnea, because with some people with OSA, with sleep apnea, it could worsen their sleep apnea if they cannot mouth puff. So, especially for people with sleep apnea, yes, we do want the mouth closed. We do want the tongue resting in the roof of the mouth. We do want nose breathing during the day. It's very important, It's not just about getting the mouth closed during sleep, but how about getting the mouth closed during wakefulness, during rest, during physical exercise? And if you are wearing a tape, the tape should allow mouth puffing. So that's important, not to cover the mouth. Sense of smell. Well, this is the obvious one. Human beings have approximately 450 types of olfactory receptors. The nose is a complex and multifaceted organ that performs various critical functions. So, its most well known function is its sense of smell or olfaction, which involves detecting and processing molecules in the air. Humans, we can detect more than 10,000 odors, and this is recognized by chemical receptors sensing the air as it's passing through the nasal cavity. Epithelial tissue in the nose picks up the smell and transmits signals through the olfactory nerve to the brain. So we have to think about this nerve. The nose is directly connected to the brain via this nerve, and we don't have this with the mouth, of course. Most smells are then deciphered into different sensations of smell we possess, but also even the term sniffing out danger, that sense of smell. So it would have been one of those traits that would help to ensure survival of the species of human beings, our sense of smell. Number 21, I just found this was an interesting one. When people have a traumatic brain injury, very often the sense of smell is compromised. And researchers here in this 2012 paper that was published in the British Medical Journal, that they used sense of smell as a sensitive test for neurological injury associated with TBI. Impaired ability to smell was the most common neurological deficit found in 65 veterans. Taste, of course, the connection between sense of smell and taste. So the nose is communicating with a part of the brain responsible for taste perception, and the brain center receives taste and smell signals and processes them together, coupling smell and taste. And of course, as kids, when you were told to drink something that didn't taste particularly pleasant, you had to hold your nose. And by holding your nose, you weren't able to smell it. And when your sense of smell was reduced, well, then your taste, you weren't going to be tasting that horrible tasting liquid. Number 23, nose breathing. We have to think about the nose as protecting the lungs, but also the more you breathe through your nose, it actually helps to protect the nose. The worst thing that we can do for the nose is not use it. If we don't breathe through our nose, well, our nose gets more stuffy. And I know there was one paper, at least with this, they had individuals switching from breathing in through the nose and out through the nose, or breathing in through the nose and out through the mouth. And when you are breathing in through the nose and breathing out through the mouth, your nose was more likely to be stuffy than when you were breathing in through the nose and out through the nose. So this is really a case of either use it or lose it. Nasal breathing can help to reduce the severity and frequency of asthma symptoms. So if we think of asthma as a condition that's affecting the lower airways, and it's often triggered during physical exercise. And of course, during physical exercise, your breathing speeds up, you breathe more air into your lungs, and quite simply, people with exercise-induced bronchoconstriction, their lungs are not able to handle the volume of air that's coming in. So that cold or dry air that's especially coming in through the mouth is going to cause airway narrowing. Additionally, some asthma medications are delivered through the nose, highlighting their importance for managing this condition. Important in the control of allergic rhinitis. Allergic rhinitis is hay fever. So the more you breathe through your nose, the better your nose works, and it can help to reduce hay fever. The other thing about the nose itself, if there's a greater demand on the nose, well, the nose can open up. And this is especially important during physical exercise. So when you do physical exercise, well, your body knows that you need more air. And in order to facilitate that, the nose naturally dilates and opens up to allow increased airflow. Now, this also points to the importance of nasal breathing during physical exercise. If it wasn't the case that you were to breathe through your nose during exercise, your nose wouldn't open up when you do physical exercise. But your nose does open up when you do physical exercise, or if you hold your breath. Holding the breath for 30 seconds or longer help to open up the nose to make breathing easier. So furthermore, it was found that physical exercise also decreased nasal resistance. Nasal resistance decreases as expired CO2 levels and exercise levels increase. So could it be carbon dioxide that's helping to open up the nose? Now, I would go as far as saying there's a remarkable difference between doing your physical exercise with your mouth closed versus with your mouth open. Because if you have your mouth closed while you do physical exercise, you will naturally have an accumulation of carbon dioxide in the lungs and blood to help open up the nose. But if you do your physical exercise with your mouth open, well, you're not going to have that same accumulation of carbon dioxide. So breathing through the nose during exercise helps to decongest the nose. We spoke about this, and the constant relationship between nasal resistance and minute ventilation during hypercapnia, high CO2, and exercise suggests that nasal resistance is regulated by the respiratory center to match the level of respiratory demand. In other words, when the body needs more air, it opens up the nose to allow more air in. We're getting to the end of our list. So number 27, it's helping to prevent exercise-induced bronchoconstriction by breathing through the nose. It's warming the air coming in. It's moistening the air as it's coming in as well into the lungs. And as a result, then the lungs, the airways in the lungs, they are less susceptible to cooling and to dehydration than if you were breathing through an open mouth. Number 28, you have better utilization of oxygen during physical exercise. This is always interesting because people might say, well, if you breathe through your nose during exercise, you can't breathe as much air. And if you're not able to breathe as much air, you may not be able to get sufficient oxygen to the working muscles. Well, is that true? It's not necessarily about the air volume, the volume of air that you bring into your nose or mouth. That's the key. We should be thinking about downstream. If you breathe through your nose during rest and during exercise, you have a better oxygen transfer from the lungs to the blood. If you breathe through your nose during physical exercise, you've got higher carbon dioxide in your blood. As carbon dioxide is a bit higher in your blood during physical exercise, that helps to improve your blood circulation. And also as carbon dioxide is a bit higher, blood pH drops. And hemoglobin then, which is the main carrier of oxygen, will release oxygen more readily to the working muscles. So when you do your physical exercise with your mouth closed, you may be breathing less air because your nose is a smaller entry to the body, in terms of the resistance of your nose is 2 to 3 times that of the mouth. So you're not going to breathe as much air when you do physical exercise with your mouth closed versus when you do physical exercise with your mouth open. And while that can be challenging at the start because of the air hunger, you have to think about the quality of the breath. Breathe through your nose during exercise. it doesn't mean that you've got reduced oxygen delivery to the working muscles. Because when researchers look at lactate post-physical exercise with nose versus mouth breathing, there's no difference. And in actual fact, there can be reduced lactate post-physical exercise with nasal breathing than with mouth breathing, because of course with nasal breathing, there's more efficient use of oxygen and oxygen delivery, that the fraction of expired oxygen is less with nasal breathing during exercise than with mouth breathing. Hence, the body is able to utilize oxygen better. Physical training with nasal breathing reduces ventilation. And quite simply, the more you breathe through your nose during physical exercise, your body adapts to that. And what does this mean? Well, it means that when you do physical exercise, you simply don't need so much air because your tolerance to carbon dioxide is improved. And with this, then, you're not going to be wasting so much energy unnecessary. Every breath that you take, it requires energy. There's energy there to support the breathing muscles. So if you can do physical exercise but reduce ventilation, you're not going to be losing so much oxygen to support the breathing muscles. Development of the face. This is always an interesting one. Children typically with their mouth open have a longer facial structure, jaws that are set back. They may have flatter cheeks, overcrowding of teeth, crooked nose. And when the jaws, when we're talking about the maxilla being set back and the mandible being set back, it can point down to a compromised airway. Now, of course, there has been a debate in dentistry about this for about 100 years or so. But we have to ask the question, why is it that mouth breathing children, in comparison to nose breathing, are more likely to have a longer facial structure? Is it the change in the shape of the face which has caused mouth breathing? Or is it mouth breathing which is causing the change in the shape of the face? Well, it could be a vicious cycle. If there was an observation of this in dentistry and in medicine, it would be very important, because any child that's coming in with their mouth open, the healthcare professional could encourage that child to breathe in and out through the nose. It's never just about treating the nose. We also have to be thinking about changing the mouth breathing behavior. And while debated for 100 years, only now in the last 3 to 4 years has there been a recognition of the importance of breathing in and out through the nose in comparison to breathing in and out through the mouth. Sometimes the simple things get overlooked. Number 31, so this is our last point here, is inducing non-ordinary state of consciousness. So there's a difference between nose and mouth breathing in terms of neurophysiological level, so that there is an enhancement of power at the slow frequencies, especially in the theta band, in the prefrontal and posterior areas of the brain, and a widespread increase of connectivity, both at slow and fast frequencies. So a heightened theta, high beta coupling in medial, prefrontal, and posterior areas. I find this interesting, because this is published in 2022. If we think about brainwave states, and it's delta, alpha, beta, gamma, theta, and brainwave states, of course, that's influencing our states of mind. And could there be a difference between an individual who's breathing in and out through their nose versus an individual who's breathing in and out through their mouth? Well, this paper here is suggesting that yes, there is, that we can influence our brainwave states by breathing in and out through the nose. So the state of consciousness experienced by volunteers seems to be mainly related to the slow-paced stimulation of the olfactory bulb. So of course, when we're talking about olfactory, we're talking about the nose, and it's the olfactory nerve that's connecting the nose to the brain. It might be possible that vagus nerve stimulation could be more effective during nasal breathing than during mouth breathing. So, 31 functions of the nose. This time next year, there will be probably a few more added to the list. But anyway, let's start with that. Why is it important to have, a kind of a repertoire of the functions of the nose? It's always good because when you're explaining breathing exercises and the importance of nasal breathing to your client, it's very important that we can back it up. There's a reason the human body has a nose. Let's use it. It has a lot of important functions.